upper limb. The upper limbs are connected to the trunk by pectoral girdle. The limb girdle is defined as the bones which connect the limbs to the axial skeleton. Parts of the upper limb. For descriptive purposes, the upper limb is divided into the following four parts: shoulder, arm or brachium, forearm or antebrachium, hand. Between the arm and the forearm, we have the cubitus. Embryology. A pair of small elevations appears on the ventrolateral aspect of the embryo called lymphats. The anterior pair of the upper lymphats appears opposite the lower cervical segments. The posterior pair of lower lymphats appears 3 or 4 days later at the level of lumbar and upper sacral segments. Thus, during an early stage of development, all the four limbs appear as paired lymphats. First, they are simple flipper-like appendages so that the upper and lower limbs are similar in their appearance. Each has dorsal and ventral surfaces and preaxial and postaxial borders. The preaxial border faces towards the head. Later in the development, the ends of the lymphats become expanded and flattened to form the hand and foot plates in which the digits develop. The digits nearest to the preaxial border are thumb and big toe in the upper and lower limbs respectively. The limbs then rotate. The lower lymphats rotate medially to 90 degrees so that their preaxial border faces medially and their extensor surface faces forwards. The upper lymphats, on the other hand, rotate laterally to 90 degrees so that their preaxial border faces laterally, their extensor surface faces backwards. Bones of the upper limb. The bones of the upper limb includes bones of shoulder region, arm, forearm, and hand. The bones of shoulder region are the clavicle, collarbone, and the scapula shoulder blade. It is also known as shoulder girdle or pectoral girdle. The scapula is connected to the clavicle by the acromyoclavicular joint, and the clavicle is attached to the axial skeleton by the sternoclavicular joint. The pectoral girdle is not a complete girdle since it is attached to the axial skeleton only anteriorly. The bone of the arm is humerus, which articulates with the scapula at the shoulder joint and upper ends of radius and ulna at the elbow joint. The bones of the forearm are radius and ulna. These bones articulate with humerus at the elbow joint and with each other, forming radio-ulnar joints. The hand or manus consists of the following parts: wrist or carpus, hand proper or metacarpus, and digits, thumb and fingers. The wrist consists of 8 carpal bones arranged in 2 rows, each consisting of 4 bones. The carpal bones articulate with each other at intercarpal joints, proximally with radius forming radiocarpal wrist joint, and distally with metacarpal bones at carpometacarpal joints. The hand proper consists of 5 metacarpal bones numbered 1 to 5 from lateral to medial side in anatomical position. They articulate proximally with distal row of carpal bones forming carpometacarpal joints, with each other forming intermetacarpal joints, distally with proximal phalanges forming metacarpophalangeal joints. The digits are 5 and numbered 1 to 5 from lateral to medial side. The first digit is called thumb and the remaining 4 digits are fingers. Each digit is supported by 3 short long bones. The phalanges except thumb, which is supported by only 2 phalanges. The phalanges form joints with metacarpals and interphalangeal joints with one another. The first carpometacarpal joint has a separate joint cavity, hence movements of thumb are much more free than that of any digit finger. Muscles of the upper limb. The muscles of the upper limb include the muscles that attach the limb and girdle to the body, and the muscles of arm, forearm, and hand. The deltoid muscle covers the shoulder like a hood and is commonly used for intramuscular injections. The arm and forearm are invested in the deep fascia like a sleeve and are divided into anterior and posterior compartments by intermuscular septa. The muscles of anterior compartment are mainly flexors, and those of posterior compartment are extensor. The muscle of hand are responsible for its various skill movements such as grasping, etc. Nerves of the upper limb. The nerve supply of the upper limb is derived from the brachial plexus, formed by ventral rami of C5 to C8 and T1 spinal nerves. The 5 main branches of brachial plexus are axillary, musculocutaneous, median, ulnar, and radial. The axillary nerve supplies the deltoid and teres minor muscles. The radial nerve supplies the muscles of the posterior compartments extensor of the arm and forearm. The musculocutaneous, median, and ulnar nerves supply the muscles of anterior compartments of the arm and forearm. Arteries of the upper limb. The blood to the upper limb is supplied by 4 main arteries: axillary, brachial, radial, and ulnar. The axillary is the continuation of subclavian artery. At the lower border of the teres major muscle, it becomes as brachial artery. The brachial artery continues down the arm and just distal to the elbow joint. It divides into radial and ulnar arteries, which follow the bones, after which they are named. In the hand, radial artery terminates by forming the deep palmar arc, and ulnar artery terminates by forming the superficial palmar arc. The axillary artery supplies the shoulder region. The brachial artery supplies the anterior and posterior compartments of the arm. The radial and ulnar arteries supply the lateral and medial parts of the forearm respectively. Veins of the upper limb. The deep veins of the upper limb follow the arteries and run superiorly towards the axilla. The axillary vein travels superiorly and becomes subclavian vein at the outer border of the first rib. The subclavian vein continues towards the root of the neck where it joins the internal jugular vein to form brachiocephalic vein. The two brachiocephalic veins, right and left, join each other to form superior vena cava drains into the heart. The superficial veins of the upper limb originate from dorsal venous arc of the hand. The lateral end of the venous arc forms the cephalic vein, which runs the lateral aspect of the upper limb and terminates into the axillary vein in the axilla. The medial end of the dorsal venous arc forms the basilic vein, which ascends along the medial aspect of the upper limb and empties into the axillary vein as well. Anterior to the elbow, the cephalic vein is connected to the basilic vein via the median cubital vein. Lymphatics of the upper limb. The lymphatics of the upper limb originate in the hand. The superficial lymph vessels follow the superficial veins. The deep lymph vessels follow the deep arteries, that is, radial, ulnar, and brachial, and pass superiorly to the axilla where they drain into the axillary lymph nodes.